And then David sent out a nice forward to us as a group for education around an executive order that just went out around pricing transparency in the healthcare industry, as well as assuring access to value healthcare, so not just lower cost, but both cost and quality is what defines value. And so I thought it might be worth just speaking to that just immediately for us. We do not participate in surprise billing. That is something that is very important to us, in that any care that is delivered in our facility is billed under our name. So that means it's billed through our relationships with our payers. And so that helps patients to not experience any surprises of having somebody who's out of network. So anybody who works with us is always in all the same networks we are in. We also have a tool in our billing department. The name of it is RICAN, but one of the things that it does is allows us to give great estimates to patients. So the patient can say, how much will a procedure or an experience cost me, and we can take their insurance, their plan, run it through there and give them insight into what their out-of-pocket costs will be. And so we've had that in place for about 3 years now, and so it gets used pretty regularly.
That very much?
Yes, yeah, every day.
Yeah,
probably every day it gets used. Yeah, and then our charge master is posted to our website, which is a requirement, but we were in compliance with it in December before it became a requirement in January. We also very much welcome the ideas that are being proposed right now around changing some of the HRA rules, because that again is to the benefit of accessing healthcare, allowing collaboration across state lines, because there's a lot of rich relationships that are going on between Washington and Oregon and Washington and Idaho. And then most importantly, the support of the alignment of quality measures across all of the federal agencies, because that is a huge burden, just to workforce burden, to be able to respond to a quality measure from one federal agency that you have to respond to just a nuanced difference, which means an entirely reworked project to another federal agency. So I just thought it would be valuable to speak to that, because it was a very good highlight of what's coming about.